for mesothelioma can save lives and extend survival by years, or it can be the wrong choice and cause complications without providing meaningful benefit. The difference comes down to the type of mesothelioma you have, the stage of your disease, your overall health, and which surgery is being considered. Today, I want to explain what studies have shown about when surgery has helped mesothelioma patients and when it hasn't, so you can make informed decisions about your treatment. I'm Terry Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this should not be considered medical advice, but I am going to walk you through what the evidence shows about surgery for mesothelioma. Let's start with the most important point. When we talk about surgery for mesothelioma, we're not talking about just one option. There are different surgical procedures with different goals, risks, and outcomes. So understanding which surgery we're talking about is critical. For pleural mesothelioma, the two main surgical options are extrapleural pneumonectomy, which is also known as EPP, and pleurectomy decortication, or PD. EPP is the more radical surgery. It removes the entire affected lung, the pleura around it, part of the diaphragm, and the lining of the heart on that side. PD is much less extensive. It removes the pleura and visible tumors but preserves the lung. For peritoneal mesothelioma, the surgery that's used is cytoreductive surgery, which is often combined with HIPEC, heated intraperitoneal chemotherapy. This involves removing all visible tumors from the abdominal cavity and then bathing the abdomen with heated chemotherapy. Just as pleural and peritoneal mesothelioma are different diseases in different parts of the body, these are completely different operations with different evidence bases, so we're going to address them separately. For peritoneal mesothelioma, the evidence is overwhelming that surgery absolutely helps when done correctly at experienced centers. Cytoreductive surgery with HIPEC has transformed peritoneal mesothelioma from a disease with a median survival of less than 1 year to one where a 5-year survival rate of 50 to 75% is achievable. Some patients are alive and cancer-free 10 or even 15 years after surgery. This is not incremental improvement. This is life-changing, dramatic improvement. If you have peritoneal mesothelioma and you're a surgical candidate, cytoreductive surgery with HIPEC should absolutely be considered. It's the closest thing we have to a potentially curative treatment for mesothelioma. But, and this is important, this only works when it's performed by surgeons who specialize in this procedure at centers with extensive experience. Cytoreductive surgery with HIPEC is a complex, intense operation. The surgery often takes 8 to 12 hours, and it comes with significant risks. The difference in outcomes between experienced centers and less experienced ones is stark, with much higher complication rates when the procedure is performed at centers without experience. Surgery is the right answer for peritoneal mesothelioma when you're being treated at a specialized center by an experienced surgical team and when your disease is confined to the abdominal cavity without widespread metastasis. You should also be in good enough overall health to tolerate a major operation and its recovery, and when complete or near complete removal of visible disease is achievable. When isn't surgery the right answer for peritoneal mesothelioma? When the disease has spread widely beyond the abdomen, when you have other serious health conditions that may make major surgery too risky, when the tumor burden is so extensive that complete removal isn't possible, or when you're treated at a center without adequate experience in performing this procedure. Now, before I go on, I want to take a little break and ask you a favor. If you're finding the information in this video helpful, please hit the like and subscribe buttons. It really helps us get seen by more people. If you have questions you'd like answered or a topic you'd like me to cover in a future video, send me a note in the comments section below. And make sure you watch this video until the end because I'm going to give you valuable information about accessing help and where to find resources. Now, let's talk about pleural mesothelioma surgery, where making the decision about surgery is much more complicated and sometimes controversial. For decades, an aggressive treatment called extrapleural pneumonectomy, or EPP, was offered to pleural mesothelioma patients who were considered good candidates. The surgery involves removing the entire lung, and despite its complexity, many thoracic surgeons believed it offered the best hope for patients diagnosed with this terminal disease. But a major mesothelioma study called MARS-2 has shown that EPP does not improve survival and actually can result in worse quality of life when compared to people who were treated with chemotherapy alone. This was a sobering finding. Patients had been undergoing massive surgeries with all the risks and difficult recoveries, and the research said it wasn't helping them live longer. Since that trial was done, most mesothelioma specialists have moved away from EPP, except in very select cases. Pleurectomy and decortication, also known as PD, that's long been referred to as lung-sparing surgery as compared to EPP. And there's better data supporting its use, but it's still controversial. Some studies show that when PD is combined with chemotherapy and sometimes with radiation, there's a survival benefit, but that's for carefully selected patients. Other studies show much less impressive results. The consensus among specialists is that PD may benefit some patients, but careful patient selection is absolutely critical. When might surgery be the right thing for pleural mesothelioma? If you have early stage disease like stage 1 or maybe stage 2 where the cancer is still relatively localized, if you have epithelioid cell type which responds better to all treatments, including surgery, if you're young and healthy enough to tolerate major surgery, and if you're being evaluated at a center that specializes in mesothelioma surgery and has extensive experience. Finally, if complete removal of all visible disease seems possible. But even then, surgery should be part of multimodal therapy, meaning it needs to be combined with chemotherapy and possibly radiation rather than done as the only treatment. When is surgery generally considered unhelpful for treating pleural mesothelioma? If you have advanced disease, like stage 3 or 4, where the cancer has spread extensively, if you have sarcomatoid or biphasic cell types, which tend to be more aggressive and less responsive to surgery, if you have other serious health problems that make surgery too risky, like if you're older and frailer, or if imaging suggests the complete removal of disease isn't possible. In these situations, chemotherapy or immunotherapy without surgery is likely to give you a better quality of life and possibly similar or better survival without the risks and difficult recovery that comes with major surgery. Here's what many patients don't understand. No matter what type of surgery we're talking about, these procedures for mesothelioma are never considered curative in the sense that all the cancer is removed and then you're done. Mesothelioma tends to spread microscopically beyond what's visible to the surgeon. Even the very best surgeon leaves behind cancer cells that will eventually grow. Surgery can reduce your tumor burden and potentially extend your survival when combined with other treatments, but it's not a cure. The recovery from mesothelioma surgery is also something that needs to be considered. For cytoreductive surgery with HIPEC, patients typically spend a week or more in the hospital and several months recovering at home. For pleurectomy and decortication, recovery is similarly lengthy. And for extrapleural pneumonectomy, recovery is even harder because you're learning to live with just one lung. It's also important to remember that during this recovery period, you're generally not going to be receiving other cancer treatments. If surgery doesn't provide the benefit you've hoped for, you'll have spent months recovering when you could have been receiving chemotherapy or immunotherapy that might have controlled your disease better. This is why patient selection for surgery is so critical. The question isn't whether you can physically survive the surgery, it's whether the surgery will benefit you enough to justify the risks, recovery time, and delay in other treatments. How do you make decisions about surgery? First, get evaluated at a specialized mesothelioma center, and by more than one of these facilities if possible. Different centers have different philosophies about surgery. Getting multiple expert opinions helps you understand your options. Second, ask specific questions like, what does surgery offer me compared to non-surgical treatment? What are the risks? What's the recovery timeline? And what are survival statistics for patients like me, both with and without surgery? You also want to know how many of these surgeries the specific surgeon has performed and what the complication rates are at the center where you're going to be treated. Third, be honest with yourself about your goals. If your primary goal is to maximize the quantity of your life regardless of quantity during recovery, aggressive surgery may align with that. But if your primary goal is to maintain your quality of life for whatever time you have, a less aggressive treatment option may work better for you. Fourth, consider your overall health realistically. Surgery requires being in good enough shape to tolerate a major operation and recovery. If you're already struggling with symptoms or other health issues, surgery may not be the right choice. Fifth, understand that choosing not to have surgery doesn't mean giving up. Chemotherapy, immunotherapy, and targeted treatments can control disease, relieve symptoms, and extend survival without the risks and recovery of surgery. So when does surgery help for mesothelioma? For peritoneal disease, cytoreductive surgery with HIPEC at specialized centers offers dramatic survival benefits. For pleural disease, lung-sparing surgery may help carefully selected patients with early-stage epithelioid disease when combined with other treatments. When doesn't it help? When you have advanced disease, an aggressive cell type, or poor overall health. It also probably won't help when you're dealing with a doctor who lacks surgical expertise. Surgery isn't right for everyone, and that's okay. Get multiple expert opinions at specialized centers to make informed decisions about surgery. And visit mesothelioma.net for more information about treatment options. To speak directly with one of our helpful patient advocates, call 1-800-692-8608 or use the live chat feature on our website. As for me, remember to post your questions below, and I'll see you next time.